causing you to be forgetful, causing you to be very negative. Your thoughts becomes negative. You can neglect your appearance. You just be untidy, you just walk like anything, you just dress up like anything and go away, causing you to make more mistakes. And that's a vicious cycle. You go from one negative point to go to the second negative and it becomes a common mistakes. Increasing your absenteeism from the work, from the school. So these are again symptoms because of that. Now, again, what will happen? You will not make a good decision. Your motor skills are affected. You no longer enjoy your work because you are under stress. Earlier you were enjoying, but now you don't enjoy that work. Your attention span is affected. And this is all a vicious cycle part of it. You have more and more negative thoughts, and that will definitely have negative impact over. Now, what are the stress-induced diseases? What happens? In the digestive system, you have acidity and ulcer symptoms. You can have irritable bowel syndrome. You can have constipation, loss of appetite. So it affects your gastrointestinal system. It can affect your circulatory system. The common is hypertension. What is the root cause? Nothing but the stress. So your hypertension is linked. Coronary artery disease or ischemic heart disease. Or your all these CAD conditions do have a stress as one of the basic root factors. Palpitations, as I mentioned, tachycardia. Low BP. Sometimes patients will have not necessarily always have a hypertension, but can have a low glucose. Respiratory symptom, they have a frequent cold, allergy. Bronchial asthma is known to precipitate. A person who is having asthma, it gets precipitated by stress. Muscular symptoms like hypo and hypertonic muscles, you get twitchings, you might have observed when you are stressed or something, you will get fasciculations or one of your muscle groups starts contracting. So that is a muscular system. Skeletal system, spondylosis, backache because of improper posture. Rheumatoid arthritis is known to aggravate due to stress. Excretory system, of course, nocturia, you get up frequently at night for urination, frequent sweating, and psoriasis is also known to flare up due to stress. Nervous system, insomnia, I mentioned. Tension, headache, commonest tendency. Commonest cause of headache in our country still is a tension headache. So that's the commonest thing. Epilepsy, migraine, this. So if the person has got one case of epilepsy, he is likely to throw season during the stress period. So these are all known entities. Depression and anxiety, again, these are two extremes. Again, that person will go into severe depression or can become more anxious. Endocrine system, thyroid disturbances, hypo or hyperthyroidism can affect both the ways. Diabetes is known to be worsened during stress. The persons who are diabetic see their blood sugar levels with the same medication during and without stress. There is a significant difference. Polycystic ovarian disease, which is again a condition which occurs in females and causes infertility. So that is also can worsen impotence. So reproductive system for the females again polymenorrhea, delayed menses, leukorrhea, again these are the things the patient can present with. But what are the warning signals which require something needs to be done? Restlessness and inability to relax. Person just can't relax, can't sit at one place, can't concentrate. Increased irritability and impatience. He just can't able to listen for 1 hour. He will start asking every 2 minutes, 5 minutes. So these are not questions or which start thinking, no, this is something going on as a warning signal. Prolonged fatigue, lack of concentration. He is just not able to concentrate. There is a fatigue which is there significantly. He is just not going to feel like working. Inability to decide. Earlier he was doing that. There are some people who cannot decide. That's a different volume. But there are people who are taking decision and now they are unable to take decision. Lack of ability to feel pleasure and enjoy different aspects of life. So again, that's a warning signal. Now what is health? I'm sure all of you must have seen this. WHO has defined health as not only mere absence of disease, but of physical, mental, social, emotional, and spiritual well-being. So it's all the separate aspects which are taken into consideration, and you should be healthy from all this. And health is a fundamental right of each and every individual. It is an integral part of the development not only of a person, but society, nation, and the healthy world around us, which is very, very important. People come and follow Ramdev Ji Maharaj. Excellent. In 2008, there was a mega city at Bandra Kurla complex. Swami Ramdev Maharaj is given as the good health is the birthright of every individual at any age. That was given, and there are of course a lot of scholars to that. Now the evolution of mankind, how we have come up from our ancestors to these human beings. Health, again, a very, very integral part of it, and we have evolved over it. But at the same time, there are risks which has evolved along with the development also. And this is, we are back to how we have started. We started becoming erect, and when the time came, we turned back on the other side. So this is what the era is. Now today's world, what are we seeing? And these scenarios are not uncommon. You must have seen this. Earlier it's a sign of prosperity. Another thing is what we are seeing is the childhood obesity, which is now coming, and which is also not uncommon. India is changing. People are ready to spend quality of life come first. If you talk to your per day,
that's not clear, right?
India is changing. People are ready to spend quality of life come first. Yeah, but this is, I don't think because it's not matching this LCD. It's not
Understand. Nice picture.
Thank you. So today you will have, if you have to speak to your Maharaj or Joshi, even he is carrying mobile. Yeah. Can you imagine that 10 years back that your Pandit or Maharaj would be carrying this? And what's going to happen to Mumbai in 2020? It's, of course, long back R.R. Patil has planned and Mumbai will be the next Shanghai. We really don't know, but this is the anticipated Mumbai in 2020, and probably the health library will be at the top of this, right? So we will have all of you sitting in a AC hall in the health library. I'm sure Dr. Mapani is working on it, and you will be sitting over there. So today I'm going to talk on this, the aspect which is most relevant, obesity and the metabolic syndrome. I'm sure all of you have heard of this entity, metabolic syndrome. As all of you are aware of this entity, or to some extent. Obesity, all of you know that. Okay, now metabolic syndrome is nothing but a multi-dimensional risk condition. It's not just one factor. Now, all of you know what is the need of life. This is what is required. But we also know what is the fact of life. We'll just go outside. There is a nice Brahmans outside here, and this is what we are going to have. So, solution is at our hand. But do we follow that? That's the most important thing. And above all, these are the people who have spoiled the culture. What is this? If you ask any young child, 3-year-old child, what is this? You show him the symbol without showing the name, he will identify. He will identify. And that is nothing but modern high-fat, high-carbohydrate diet. You know what is that symbol M stands for? I would put it as nothing but invitation to metabolic syndrome. It just is an invitation to metabolic syndrome. Okay, now the various factors, probably I don't know, it's not matching. So it's the hypertension, obesity, diabetes, insulin resistance, atherosclerosis, that is the blockage in the vessels, then coronary heart disease, chronic kidney disease, patients who require dialysis, peripheral vascular disease, those limbs require amputation, cerebrovascular disease, that is a stroke, liver disease, the persons who have chronic liver disease. What is the root cause? The center behind it is metabolic syndrome. And that is the root cause for everything. It's going to lead or start from metabolic syndrome. Now, we are Indians, Hindustani, we are Indians, and we Indians are at high risk. Now, if you consider our counterparts in West, we Indians at our age group, comparable age group, are at much higher risk of getting a heart problem. That's coronary artery disease is very, very prevalent in our country. Now, there is nothing called a sudden heart attack. You always talk of, oh my God, you didn't have anything, a sudden heart attack. Now, there is nothing like sudden heart attack, which is a belief. It requires years of preparation. You have to prepare yourself to get that heart attack. And that is going on in your lifestyle, your eating patterns, what you are following at home. And these are all contributing factors. So you have started preparing yourself for that. If you want that, you are preparing for it. It doesn't come suddenly. So that's a misconception. Now, what are the risk factors? There are various A, B, C, D. A for age, as the age advances, obviously the risk of